Assalamu alaikum viewers, I am Wasif Naqvi and today we are going to discuss tobacco control in Pakistan, and we have with us a very big name, Dr. Fawad Aslam. Dr. Fawad Aslam, thank you very much for taking out time, and we wanted to get benefit from your experience and you are among the big names for starting the tobacco control in Pakistan since Pakistan became a signatory to a framework convention on tobacco control. You have been engaged with several activities and issues related to tobacco control since then, one way or the other. So first of all, we just want to ask you that how did you get engaged with the tobacco control, and how Pakistan became a signatory to Fctc, even though we were already having some laws and we have uh, health related laws in place. We had 1958 Tobacco Vendor Act, 1979 health warning, and finally and more significantly 2002 Prohibition of Smoking and Protection of Non-Smokers Health Ordinance.
Thank you very much. Thank you for having me and for saying such nice words about me. I don't think I'm a big name, not anymore at least. And I haven't been involved since 2004 when Pakistan became a signatory. I got involved in 2008, which was right about the time when Pakistan joined the Bloomberg program, which was an initiative in the low and middle income countries, and Pakistan was one of the first ones to get the grasp. So I'll just go with the second part of your question first, which is about how Pakistan became a signatory to Fctc and all the laws and stuff. It's true that Pakistan had some laws before that, but Fctc, I would like to say that two laws were important: 1979 Ordinance on pictorial on health warnings, and the 2002 law, which was a pretty comprehensive law for its time, and it predates Fctc. It was passed in 2002. Fctc became an enforceable treaty in 2004. So our law actually predates Fctc, and that's why it had certain lacunas at that time. Anyways, Pakistan was always very actively engaged in tobacco control. I would like to give credit to our non-governmental organizations active at that time, especially the Network for Consumer Protection. There was Coalition for Tobacco Control. And there were also, may Allah bless his soul, Dr. Abdul Sattar. He was in WHO and he was working with the ministry. So these, Dr. Essen was spearheading the TFI initiative in the network. So these organizations work with the ministry, and we were very active in the whole process of Fctc. You know, it's a treaty of all the countries, majority of the countries. So Pakistan was very vocal in that, and Pakistan was one of the first 40 countries to sign it, and it needed a signature of 40 countries for it to become a treaty, an enforceable treaty. So Pakistan was amongst the early signees of that treaty, so we were quite proud of that. Once Fctc came into force, Fctc mandated that Pakistan should, or all the signatory countries were bound to implement the articles of Fctc as best as they could. And it gave certain time frames for that. We'll not go into the details, but one of the requirements was to have a dedicated, you can say, infrastructure or a unit to look over tobacco control. And for that purpose, a National Tobacco Control Cell was formed in the Ministry of Health at that time. This is pre-devolution scenario, so there was a Federal Ministry of Health. So a skeleton structure was set up, and then the organization which I work for, the union, it stepped in and started funding. So we created positions, a lot of people were employed, and then the whole project took off, and we supported the ministries as well as civil society organizations to have a sort of like a holistic approach towards tobacco control. I got involved in 2008. I started working for the union in May 2008 as the country lead, technical officer, focal person, whatever, for Pakistan. At that time, our regional office was in Cairo, the Middle Eastern, sort of like similar to the WHO regional offices. Mm-hmm. The union had regional office in Cairo at that time. Our head office was in Edinburgh. So we started to work with the government as well as civil society. On the one hand, pushing for legislative changes and policy development through the government. and asking the civil society to support them by raising the issues in the media, the press, bringing it to the attention of the policymakers, but at the same time to keep a check on what the government was doing and criticize them where necessary. Although we always try to maintain a good balance between, not good balance, good relationship between the government and the civil society. Our approach was not to have them fighting with each other, but to work collectively together. And like you said, we worked on almost all the aspects of tobacco control in our long association. It's still going on. I've left the union. I shifted to the UK because of some reasons, and I felt I couldn't sort of like keep up with the demands of the work. I wasn't doing justice to my job because I wasn't here. I couldn't meet with important people. So the union is still carrying out its work under the leadership of Khurram Hashmi. He's a good friend of mine, and is a very good tobacco control activist. So that work is going on. So that's how I got into it. And sorry for the long answer, but it was a long question.
Thank you very much for bringing it to our notice. FCTC makes obligatory on Pakistan to comply with its MPOWER component, and for the benefit of the viewers, I would just touch upon that. M is for monitoring tobacco use, P is for protecting people from the tobacco smoke, O is for offering help in quitting tobacco, W is for warning about tobacco dangers, E is for enforcing ban on tobacco advertisements, and R is for raising taxes on tobacco. We also understand that you are a big proponent of O, or help in cessation activities, something which is happening in Pakistan at a very micro level. So what are your suggestions in making MPOWER more, effective in case of Pakistan?
Once again, it's a long question, but I'll try to be brief because I don't think we have that much time. But to summarize it, for all aspects of MPOWER, what you really need is federal government, or whatever now since the devolution, it's the provincial governments on board as well. You need commitment from them. You need tobacco control understanding and commitment to make tobacco control sustainable. For that, the government has to realize the importance of tobacco control, and it has to dedicate staff and resources to tobacco control. We tried a lot to make tobacco control sustainable and to bring it at the top priority of the government. Before 2011 of the federal government, and after 2011 with the federal as well as the provincial governments. Without total government involvement, commitment, and ownership of the tobacco control program, these things cannot progress to the level that we would want them to progress. At the moment, almost all the activities are donor driven, right? If we want to do a lot of things, but if the donor is not funding them, we are not able to do it. Classic example, let's just briefly touch on each one of them. M, which is monitoring. How many indigenous tobacco control big scale studies or research are you aware of in Pakistan? A few have happened in the recent years. You have done a bit, and I think the other one is SPDC.
Yeah,
they have done a bit, but then again, that was funded by the donors.
Exactly.
University of Illinois, Chicago, French Look, all that stuff, Johns Hopkins. But the biggest data that is collected usually is the GATS survey, Global Adult Tobacco Survey. That's done by WHO in collaboration with CDC. The last time it was done was in 2014 and 15. That's in Pakistan in terms of the population multiplies every year. That's outdated at present. And in every discussion you see people bringing up the number of 1,200 children take up smoking every day. That's a 1999 survey. I don't understand if we should even be quoting that. So because we don't have our own indigenous resources, we have the resources but no indigenous study done, we are not able to monitor what we would like to monitor in Pakistan as frequently as we would like to. And it's not that difficult. Every year you have the PDSP survey, I think the Population Development Survey. You can have a few questions in them related to tobacco control and you'll get new data every year. But this is something that needs to be taken up by the government once and only when it realizes what it's doing, what it wants to do. If tobacco control, it was a failure on my part. I wouldn't say a failure, but it was definitely a shortcoming. We tried really hard to make tobacco control sustainable, and that government should have dedicated staff and sustainable funding for it, but we weren't able to do so because Pakistan is mired in so many other health issues which are more acute in nature. I mean, nobody realizes that tobacco control is the single biggest preventable, you know, tobacco is the single biggest preventable cause of death in the world.
Exactly.
But since it kills very slowly, we tend to overlook it. We tend to look at it as a, social evil or a habit which is frowned upon, stuff like that. But if look at this dengue, look at this COVID that's going on. How many lives has COVID taken? A few thousand. I mean, may Allah bless them all. I'm not saying it's something small, but tobacco-related deaths every year number
Is increasing.
150,000. That was the latest, 160,000 per year in Pakistan alone. But since it's behind the scenes, you can say it doesn't get that much attention. So we need to focus on that. We've got very good laws in Pakistan. We've got good laws to protect the people. But once again, enforcement of laws is a very challenging situation in Pakistan. When the administration cracks down, you get better enforcement, but then it fizzles away and we're back to square one. And the enforcement of laws is only in the big metropolitan or the major cities. But if you go to the rural areas, do you even think that anybody would be enforcing tobacco control, don't smoke policies? No. Regarding like you said, completely non-existent. A few clinics have been set up, but they already have got skeleton staff, and they just provide bare minimum counseling services. There is no dedicated staff which has proper training in tobacco cessation. The union has a very nice booklet in association with WHO based on tobacco cessation and TB control, tuberculosis and tobacco cessation and everything. There are so many, but we don't, our people who are working in these clinics are not thoroughly trained on this. And then we offer nothing in practical terms for the smoker. If I somehow encourage you or convince you that smoking is a bad habit because of the warnings, because of the pictorial sizes, the laws, everything, and you want to quit, you have no avenues left. There is a quit line number, which is a mobile phone number, right? So they will direct you to one of these clinics. You will go there and they will tell you the basic things, don't do this, don't do that, refrain from being in the company of people, try to drink a glass of water, that kind of stuff. These are good counseling advices, but everywhere in the world you see, I believe in the science of the numbers that come up, and the quit rates are extremely low all over the world without pharmacological intervention. And for Pakistan, there is no pharmacological intervention available for the common man. I checked in 2017, and the cost of nicotine replacement therapy, maybe it a patch or chewing gum, it was around 10,000 rupees at that time. And the dollar at that time was 126 rupees. So now it's up to 176. All of it comes from the Western world. You can well imagine the cost. If it is multiplied, it would be around 20,000 minimum. How many Pakistani people who want to quit smoking can afford 20,000 rupees a month as a test? They don't even know whether it will succeed or not, because the quit attempts, even with NRTs, is around 9%. It's not high. It's a very difficult task for people to quit smoking without help, and unfortunately we aren't doing anything in that. Rest of the I don't think we have the time to go into details of everything, but EWR, yes, we're working on that. We've done good, and we have enforced the bans on taps, although you'll see violations, especially in the rural areas. You'll see plenty of violations everywhere. Warnings, we are still stuck on 60% with the talk of going to 75 and everything, but let's see how that pans out. There's always industry opposition to that. And taxes is a huge topic in itself, very interesting. We have come a long way. A cigarette pack was available for 26 rupees when we started, and now the minimum price is around 67. So we have managed to increase taxes and increase the revenue every year since 2008. A lot of work has gone into that, but a lot of work goes onto the other side as well. They are also working very hard, the tobacco companies, to convince the government not to increase taxes. It's an uphill battle, but now with the new track and trace system that's supposed to be enforced, I've got good hopes from that. I think it's a positive development.
So you have answered my next question, but still I'll try to ask you that, sir, as you know that tobacco control cells and the donor working in this domain are working very sincerely, and you know that government support is, I mean, it's negligible in terms of in monetary terms. So how would you look at it? I mean, there's hardly any government support available. Instead, the government is promoting tobacco through Tobacco Promotion Board. So, how do you look at this issue?
I, I think these are two separate issues. I don't think government is promoting tobacco would be the right terminology to use. What, at least what they say, I think that the thing is that they want to have a bumper tobacco crop to export. They're looking to export and earn dollars because Pakistan needs the foreign exchange. Since tobacco is a legal crop, tobacco farming forms a livelihood of hundreds of thousands of people in our Mardan, Swabi, Chasada, all this KP belt.
Yeah.
It's a very, very important crop. We cannot simply dismiss it because we are against tobacco control, because we are against tobacco. Like I said before, it needs a holistic approach, and Fctc does provide it. If we want to get rid of tobacco crops and the farming and stuff, we need to provide them with alternate livelihoods. That's a condition. That's one of the articles of Fctc. We sign on it, but we are not working on it because we don't have the funds for it. The donor is not interested in that, right? So this is a policy area which is completely neglected. So I wouldn't say that the government is actively promoting tobacco at the cost of the lives of Pakistani people. That's something which is taken as a cash crop and good for export purposes. I think that's what my understanding is, which might be wrong. Regarding the tobacco control cells and government funding, yes, like I said before, unfortunately, the funding from government is negligible. Although we have had really nice, committed, dedicated staff throughout the years, working not only at the federal level but at provincial levels, at district levels. I mean, the district administration of Islamabad has been so supportive of the Tobacco Free Islamabad initiative. I mean, they work really hard, whether it's enforcement raids, whether it's putting up placards or signboards, billboards and that kind of stuff. They work really hard. The Ministry of Health, now the Ministry of National Health Services Regulation and Coordination, has always had a focal person there looking after tobacco control activities, our projects, other projects. Very rarely there has been an issue. Most of the time they've been really supportive. Right now, Dr. Samra, she's also very supportive. They own the projects. They own the work that is being done with the support of the union, because all the tobacco control work that is done after approval of the government by the donor agencies, right? Mm-hmm. The union, other agencies which are working, they're all working after discussing it with the tobacco control cell. But once again, the thing comes down to, if we don't have dedicated resources, we are not able to do the activities which the donors are not interested in doing. And I'm not saying the donors are against them. It's just they also have limited funds, and they try to prioritize, and they feel that, for example, cessation doesn't give them the cost-benefit ratio of another intervention like tobacco taxation, right? They feel that that's a much cheaper way to reduce tobacco consumption, which is fine. So we need to convince the governments. The government needs to think about it, take ownership, and work at least on those areas which are not covered by the donors. This has to be a synergistic kind of approach in which one party complements the other party. It's not that, unfortunately, since we don't have the funds. But one last thing I would like to say on this is that in a country like Pakistan, most of the issues, social issues, health issues, education, whatever, are done when somebody at the top takes a personal interest in that, right? फलाने ने notice ले लिया, ये हो गया, वो हो गया, motorway पे ये हो गया, notice ले लिया. When somebody takes a notice, then things get into motion. If somebody doesn't take a notice, things don't get into motion. If the Prime Minister, who is a big advocate of health, and he has his own hospital, and they have been really supportive over the years. Shaukat Khanum Hospital, they've worked with us. They've come on short notices to attend, these World No Tobacco Day activities and stuff. If tobacco control somehow gets to his attention, with the proper briefing and stuff, I'm sure it will make a big change. I mean, if he gets to know that we don't have dedicated funding, we don't have dedicated staff at the federal level, what to talk about provincial level. There are small setups, but if somebody like him or the health minister who has attended World No Tobacco Day activities, I've met him, he worked with us. If they take a notice of this, then there's a chance, which is unfortunate because it should be systematic. It shouldn't be dependent on the person. But that's the way the country is run. So I think this is one of the areas that needs
Okay. So related to tobacco control, the government is very supportive, we know. But still, there are some issues with taxation side. The Fctc guides us to at least go for 70% tax, whereas Pakistan is standing at 63% or so.
Depends. Yeah.
From the last two budgets, there has been no increase in the tax. How do you look at the issue?
There's one way is to look at just the last two budgets, and one way is to look at what has happened since the whole tobacco control process started in Pakistan. Like I said, back then, 26 rupees a pack, I think, was the maximum price. Right now, the minimum price is 67 rupees. You can't sell. Of course, people sell it below that, but that's counterfeit. Yeah. So we have come a long way. Taxation has increased from measly 25% or so, now up to 63%, like you yourself said. I think personally, a big setback happened in 2016-17 when the government introduced a third tier, a lower cost third tier, in which the tobacco companies dumped all their most sold products in that low cost tier, and the sales skyrocketed. The revenues increased a bit, but the sales were through the roof. And the flip side was that the Pakistani people were buying more cigarettes and smoking more cigarettes. So one good thing that this government did was step by step, in the first two budgets that they did at least, they increased the prices of the third tier back to almost the same level of taxation which was before the introduction of the third tier. I think that was 34 rupees and they came up to 32 rupees. Looking at the last two budgets, to be honest, I mean, when we were discussing these issues, I was of the opinion that nothing is going to happen in these budgets. They are not going to increase the prices. Some people were convinced that no, they will increase the prices. And I said, I don't think they can because of the COVID situation, all the industries, everything was shut down, and people were suffering a lot. That's my opinion. Could be wrong. I thought that it's very difficult at that time, at the peak of COVID in 2019 and 20, that the government would go for a price hike on anything. We have to understand that this is a legitimate industry. This is a legitimate product that is being sold in Pakistan. This is a favorite industry of the FBR because it pays a huge amount of money. I think it's the second or the biggest taxpayer.
I just wanted to dovetail another question, and that is related to the effectiveness of track and trace system. As you're talking about FBR, I just wanted to interrupt you and want to ask this question.
Yeah, I'll just come to that after. So it is my opinion that they didn't want to sort of like rock the boat too much. They were getting 110, 15, something like billion rupees from the industry, and if they increase taxation, the industry would just stop selling cigarettes and say, loss of revenue and the government. So it was very difficult for them to raise taxes in those couple of years, but they should. There's no doubt about it. We need to go up there. We need to make cigarettes unaffordable. The cost of living has gone up so much. Inflation has increased so much. So one of the ideas is to link tobacco taxation with inflation along with an annual increase. So definitely they should do it. But as you know, I mean, there are people within the government itself, within the power circles that are associated with this trade, and they certainly don't want the taxes to increase. So it's always been a battle like this. I mean, be it this government, the previous government, it's always been, we try to convince them, they come up with something, and, but these 2 years have been special because of COVID. Regarding the dovetail question of track and trace system, I think it's a really good thing. We struggled really hard for it. We've been striving to get it for the past, I think, 8 or 9 years. It just simply never moved forward because FBR was reluctant, especially tobacco industries were so reluctant. and they are very powerful people, and they can influence policymakers. Thankfully, I never thought I would say this, but one good thing that has come out of an IMF agreement is that they mandated that track and trace has to be there on these products. So the government had no choice but to implement it. The first round that happened, it went into litigation. We got delayed again, but now this has come up. What it does is it makes counterfeit sale that much more difficult. Everything needs to have a stamp on it, and if it's a good system, then all the cigarettes that are produced as soon as they are stamped gets reported into the central database of FBR. So they get to know exactly how many cigarettes are being produced in the factories, and then they can collect revenue based on that, not on the numbers provided arbitrarily by a tobacco industry. Because as you know, we don't get any data of how much cigarettes are produced and how much cigarettes are sold, except for what they tell us. Yeah. So technically, this should allow us. But we are all, the proof is in the pudding. We'll see how the system works, because there are so many ways in which Pakistan, can circumvent it. The people have factories going on in their basements. It takes a very small machine to produce hundreds of thousands of cigarettes and that kind of stuff. But that's an enforcement issue. That's not a policy issue. These are two separate things which the industry and sometimes the people who oppose taxation try to, mix it up. You can see counterfeit cigarettes. Yeah, of course, but that's an administration issue. If you can see them, surely the administration can see them and they can confiscate them. So that's a separate issue. I think it's a positive thing. It will help to increase tobacco taxation revenues and bring everything and make everything more documented for future revenue.
So my final question is regarding new novel products. I'll quote here a report published by The Guardian, and they claim that one of the tobacco conglomerate is planning to spend £1 billion in Kenya and Pakistan. So I must confess that their campaign has been extremely successful in case of Pakistan, and STPI is looking at the enormity of issue in the forthcoming papers. So how do you foresee the future of these products in Pakistan? I'm talking of the initiating and indulgence of vaping, the e-cigarettes, dipping, and the use of nicotine free pouches here.
Yeah, I think it's a very important issue, but a very contentious issue at the same time. My position, solely my position, it differs from the position of my organization, which I used to work for. I must tell your audience that for the past 1 year I've been taking a break. I'm not engaged in working for any organization on tobacco control or in Pakistan. This is my personal opinion. I think, as you know, the union, Bloomberg, which are the major donor agency, the Bloomberg, which works through union and WHO and stuff, they're all dead against it. They say that they should be completely banned. All these novel products should be completely banned. Not regulated, banned. There's a different point of view in a lot of places around the world now, with science to back it up. And my point of view is that these are novel products. At the moment, I'm living in the UK, and I really believe in the public health system of the UK. We have to realize that we follow the UK guidelines in almost every aspect. Our physicians, our surgeons, gynecologists, you name it. Every medical discipline follows the Royal College of Physicians or Surgeons or whatever. So their degree is one of the best in the world, right? That's what we do. Public Health England, as you know, states that these products are 95% safer than combustible tobacco products. Vaping, they say, is 95% safer than a traditional cigarette, and they do encourage vaping as a means to quit tobacco, the dependence on cigarette. They are actively promoting it. There's talk of selling it in hospitals now, providing people with it. And I can personally vouch that all these products which you mentioned, especially the vapes and e-cigarettes, they are readily available at chemist shops. You can buy them over the counter, no problem. In fact, tobacco sales are behind, closed cupboards. You can't see them, but vapes are openly displayed in the major stores. And they have dedicated vaping stores almost everywhere. I live in a very small town and we have 3 of them, right? My point of view is that there have been a few studies that have come up which have shown that vaping is a very effective way of quitting cigarettes. There was a very famous study done by Mr. Krajcik, and you can see it online. I can provide the link if you want to, which said that, I mean, they compared two groups in the NHS, the National Health Service of the UK. Both groups received, these were conducted in, I think, 3 centers of stop smoking services. One group received counseling and nicotine replacement therapy. The other group received counseling and e-cigarettes. And at the end of the study, the outcome measure was abstinence as self-reported, or at least a 50% reduction in consumption, and then biomarker test, carbon monoxide level in the body at the end of the study. And they found out that NRT plus counseling, the quit rate was 9%, but counseling and e-cigarette quit rate was 18%. So it was double the quit rate of just using NRTs. There is also other data. There are some studies which say that NRTs are more effective. There are some studies say that e-cigarettes are more effective. But the Public Health of England says that the best thing is if both of them are done together. Someone is trying to quit use of e-cigarettes along with NRTs, they have the best possible outcome. But in any case, they say that the groups which had some form of e-cigarettes going on, they had the highest quit rates in whatever studies you do, whether it's a combination or separate. So my opinion is that if these products help people to quit smoking, then we should not dismiss them outright. There are a lot of claims that say that, they are a gateway to smoking. Teenagers will take them up and then turn to smoking. Okay, although this has not been proved. This is just conjecture. No studies. In my experience, to the best of my knowledge, I don't think there's any proof of that. But the thing is, what I don't understand is that we are allowing a known carcinogen to be sold, but under regulations. Increased taxes have a warning on them. But if something which an organization like the Public Health of England is saying is up to 95% less harmful, we want to completely ban it. So if I'm a smoker and I'm addicted to nicotine, people have to realize that smoking is not a habit, it's an addiction. Nicotine is a very addictive drug. Yeah. Nicotine is more addictive than heroin, right? In its addictiveness, because people can leave heroin, but nicotine is really difficult to get rid of. You can't give it up. So a person who is addicted to nicotine needs to have that nicotine one way or the other. So if we ban these products, novel products, the only option left is cigarettes. So if you look at it, once we ban these, we are just allowing them to use cigarettes, right? So is that a good thing? That's all I asked myself and my colleagues.
Obviously not.
I said, maybe this is 95% less harmful. Mm-hmm. If we ban this, we are going towards something which is 100% harmful. We discuss it every day. 72 known carcinogens, 4,000 chemicals, all this in cigarette products. We're just not allowing them a second chance at all. What I think should be done is, these should be regulated, not banned in my opinion. They should be regulated, and only certified, approved varieties should be allowed in the market. At the moment, what you see is tens of thousands of varieties in these beautiful shops, which have cropped up everywhere, vape stores in Pakistan, Islamabad. We have got all these Chinese products. There is no regulation. We don't know what's in them. We don't know anything about it. So these should not be allowed, in my opinion. In a country like the UK, every e-cigarette that is present is regulated. Everything is known, their constituents, everything, right? And they only allow a maximum amount of, I think it's 8 mg per milliliter or something like that, the concentration of nicotine. The deaths in the US that happened, these were all homemade kind of stuff. They were introducing THCs and additives in that, which led to all that lung infection and death in the United States. Not a single death in the UK and the European countries, because everything is so strictly regulated. So if these are strictly regulated and only approved and proven products are allowed, then they might help people to quit smoking. That's my opinion. And I think the government should conduct, people should conduct, your organization if possible, they should conduct a study. Why don't we conduct our own studies like Mr. Krajci? If he did it, can't we do it? We have these new cessation clinics that have come up. We can do a study of people who want to quit, give them a choice of e-cigarettes, give them a choice of NRTs, and see who fares better at the end of 6 months, and also take into consideration the cost. Like I mentioned, 20,000 rupees per month. I think this is around 3,000 rupees a month, something like that. So these are, I mean, in my opinion, just to summarize, I don't think we should just summarily dismiss them. They should be given a serious thought. Look at the science behind it. Look at why the Public Health of England is promoting it as a quit mechanism, and then make a decision. I want to clarify, I'm not promoting e-cigarettes. I don't think they are a good thing. My personal opinion is you should not inhale anything except clean air. The only things that should go into your lungs is clean air, which unfortunately we don't have too much of. But so don't smoke, don't vape, don't do anything. But if you have a nicotine addiction, or if you have to do something, then these might be safer than that. And that definitely we know for a fact is a carcinogen. And in my opinion, if we are banning them, we should ban those as well.
Thank you very much. Thank you very much, Dr. Fawad, for this very valuable discussion. And I'm sure that our viewers would have been benefited from your valuable thoughts. We should not take anything other than clean air. This is the baseline of the discussion we had with Dr. Fawad. Thank you very much, Dr. Fawad, once again for taking out time.